When you have just recently undergone breast cancer surgery, whether it be a mastectomy, a node dissection, or even reconstructive surgery, there is bound to be tightness across the chest, probably accompanied by pain from the lack of blood flow to the area and the constant spasm of the pectoralis muscle. So one of the most important things that you're going to need to do is to stretch out the chest and strengthen the opposing back muscles. But this video will focus on some very simple ways that you can begin to stretch your chest muscles. Remember, you should never have any pain other than what you may be dealing with post-surgery, which hopefully this will help to minimize. You should only feel a mild stretching sensation, and if anything you do begins to make you feel more uncomfortable, then you must back off. Also, of course, make sure that you've been given medical clearance from your doctor to perform any exercise. Now, I am using the BOSU balance trainer. If you do not have one, you may certainly do this sitting on a chair or on your floor. You may also use an exercise ball. So I'm sitting right in the center. I'm going to turn to the side a bit and so I can redistribute my weight. And the first exercise is simply going to be to place your arms along the side, keep a slight bend in your elbow, draw your belly button in towards your spine, keep your head in alignment, and what I want you to think of is squeezing your shoulder blades together. Now, I'm looking at the camera, but when you're doing this, you should be looking straight ahead and focusing on contracting your shoulder blades while you're holding this stretch. Now, optimally, you want to hold the stretch for a good 20 to 30 seconds, but if you have to work up to that, that's fine too. Go at your own pace. Now, if you don't feel much of anything from that stretch, or if you want a little more of a stretch, then you can place your arms behind your head. And the same thing's going to apply. Belly button's drawn in, chin is in neutral, and you're going to push your elbows back, squeezing your shoulder blades together, and make sure that you're not arching your back as you do this. We have this tendency to overcompensate as you push back. So maintain that strength in your abdominal area and focus on your breathing. You can close your eyes, take nice deep breaths, and when you're done, if you need to shake your arms out, it can be tiring just holding the arms up like that. So gradually work up to 20 to 30 seconds. And lastly, if you want to advance from there, I'm going to show you the next phase, but also if that was a little bit too hard for you, please go back to the first example, which was just sitting with your arms behind. So what you're going to do here is you're going to go down to the base of the BOSU balance trainer. Now, if you've had an abdominal tram surgery, you're probably going to have to go down sideways and roll up on the dome. Otherwise, you can roll yourself back. And what I want you to do is just start. You can either put your arms up or you can put them right behind your head and gently let your head be supported by the dome and continue to squeeze your shoulder blades and feel that stretch. And if you want to open your arms out even wider, that might give you a really nice relaxing stretch. Opening up the chest. Think about simultaneously squeezing your shoulder blades together and try and hold that. Now, if this was too much, then you're going to go back to the second one, which was doing that sitting upright with your hands behind your head.